Welcome to this Wound Club Online educational module on the importance of a skincare pathway. This module forms part of a series of modules that you can access to develop your knowledge and understanding around wound care management and skincare. Skincare can include a wide array of areas in wound management. This module will cover skincare pathway in related to moisture-associated skin damage. Today we will be discussing the importance of a skincare pathway in relation to moisture-associated skin damage, or MASD. By the end of this module, you'll be able to identify why a skincare pathway is needed to help manage MASD and to understand what a skin pathway includes. Firstly, let's recap on what the four types of MASD are. MASD is defined as the inflammation and erosion of the skin, caused by prolonged exposure to various sources of moisture. That includes urine, stool, perspiration, wound exudate, mucus or saliva. It is generally accepted that MASD consists of four distinct conditions, each having a slightly different etiology, namely incontinence-associated dermatitis, intertrigo, peri-wound moisture-associated dermatitis, and peristomal irritant contact dermatitis. It's important that you distinguish between the four conditions to ensure appropriate prevention and management. For more information around the four types of MASD, be sure to check out the MASD Wound Club Online module. MASD represents a significant problem and can have a negative effect on patients' well-being and quality of life. The development of MASD involves more than just bodily fluids alone. Rather, skin damage is attributable to multiple factors, including chemical irritants within the moisture source, its pH, associated microorganisms on the skin surface, and mechanical factors such as friction. This can cause significant distress to the patient and affect their well-being and their quality of life. From personal experience, I have also seen patients' mental health suffer from MASD and an increase in their healing time due to the misdiagnosis of the type of wound they have. For an IAD in particular, the precise number of patients affected is unknown due to the difficulty in distinguishing IADs from other wound types. Example, pressure ulcers. For the healthcare professional, MASD can affect costs on wound products and nursing time as well. From my previous experience, I have found my caseload increase due to the less patients healing, as there were confusion between treatment plans due to the misdiagnosis of MASD and other wounds. Vigilance in maintaining both optimum skin conditions and in diagnosing and treating early stages of MASD is important to prevent progression and skin breakdown. Risk assessment and prevention strategies are of key importance. Interventions can be taken to protect the skin and to prevent MASD, including the use of skin protection products such as barrier creams and liquid polymers to create a protective layer on the skin surface, as well as maintaining hydration levels whilst also blocking external moisture and irritants. Having skincare pathways in place gives clinicians a step-by-step guide on how to assess the patient's risk of developing MASD and how to treat it if it's already developed. A step-up, step-down approach can often be used, which allows for use of multiple products dependent on the severity of the damage. And remember when to adjust skincare once the area improves. We'll discuss the step-up, step-down approach in more detail later on. Having this tool can also save time. It allows a clear path in the product selection to reduce the time that may have been spent considering which to use and why. It takes out the legwork and a simple chart to quickly and easily follow. For example, Bayer et al. Introduced a structured skincare protocol in 2 nursing homes and found the presence of incontinence-associated dermatitis was significantly lower after 3 months of implementation, and staff time per patient per day was reduced by 34 minutes. Staff cost of just under £9 was saved per patient per day. So what should a skincare pathway consist of? In theory, clinical pathways could be implemented in any area of healthcare, i.e. preventative, acute, chronic and palliative care. They mainly focus on the processes in relation to effectiveness, patient safety and/or patient-centeredness. Firstly, they should focus on the overarching aim and what they plan to achieve, and essentially how they plan to achieve this. including what steps are needed to accomplish that goal. They should include what the assessment criteria is, essentially what the clinician should look out for when assessing the patient for MASD. Then it will need to guide on what type of product should be used, dependent on the assessment, and how that product should be used, e.g. how regularly to apply, what combination of products, etc. Sometimes cases will need to be referred to other healthcare teams. For example, if an infection appeared, then a specialist wound team would need to be included to develop the correct course of treatment. To help identify wound types and provide a guide for the clinicians using the pathway, example images of wounds can be included on the pathway. Pictures are often a valuable tool to explain what skin types requires what treatment. Lastly, the pathway should know how and when the patient should be reassessed once the pathway has been used and completed. Let's take a deeper look into IAD and how pathways can guide clinicians through preventing and treating them. Clinical pathways, or CPWs, are tools used to guide evidence-based healthcare. The aim is to translate clinical practice guidelines recommendations into clinical processes of care within a unique culture and environment of healthcare institution. A CPW is a structured multidisciplinary care plan with the following characteristics. It's used to translate guidelines or evidence into local structures. It details the steps in a course of treatment or care in a PAM pathway, algorithm, guideline protocol, or other inventory of actions. It aims to standardise care for a specific clinical problem, procedure, or episode of healthcare in a specific population. The IAD pathway we have just gone through is only one example of the skincare pathway, but there are others available. One very popular example is the use of a step-up, step-down approach. On the left, you can see an example of a step-up, step-down approach, which includes wound imagery of the different stages of skin conditions. The use of the imagery with the categorization is a valuable tool to identify the extent of skin damage, and is not only useful to determine the product use, but also to help with documentation. This categorization can then be matched with the cleanse, protect, and restore pathway to determine which products to use at which stage. Other pathways are also available to help determine what type of MASD is displayed. Just remember, IAD is just one of the 4 types of MASD. This pathway you can see now has been adapted from the Dowser et al. 2013, and it follows the use of implementing a structured skincare regime and treatment plan per type of MASD. You have now completed the Wound Club Online module on the importance of a skincare pathway. To check your knowledge and understanding, try and answer these quiz questions. Well done, you have now completed your Bitesize module. Take the time to reflect on how you will take some of what you've learned and apply it into your daily practice. Please click on the link in the description below to get the full 15-minute version of the presentation. Once this is completed, you will have the opportunity to download CPD revalidation forms.